All right, let's jump right in. What if I told you that your body's largest organ is also kind of its biggest gossip? It's true. It's constantly sending out messages about everything that's happening on the inside. So today, we're going to learn how to actually listen to what your skin is telling you. So, say hello to the integumentary system. It sounds complicated, but it's really just your skin, hair, and nails. And get this, together they make up a massive 15% of your total body weight. But the system is so much more than just a protective wrapper. Think of it like a living, breathing dashboard that's giving you a real-time readout of your internal health. And, that really brings us to the big question for this whole explainer. If our skin is this dashboard full of signals and alerts, how in the world do we learn to read it? How do we start decoding the messages our body sends to the surface every single day? To figure that out, we first have to get one thing straight. This whole system is way more than just skin deep. It's this incredibly complex, vital barrier that's not only protecting you, but is also trying to talk to you, constantly. I mean, just look at this list. It really shows you the sheer multitasking power of our skin. It's not just sitting there, it's our #1 shield against infection, it's our own personal thermostat, it's a super complex sensory network, and it's even a little solar-powered factory whipping up essential vitamin D from sunlight. This is an incredibly active and intelligent system we're talking about. So knowing all that, how do healthcare professionals actually check it out? Well, they pretty much approach it like a detective. They use this really systematic process to gather clues from the surface to piece together the story of what's happening underneath. And the framework they use? It's surprisingly simple. Honestly, it all boils down to 3 basic actions: look, touch, and ask. Yeah, in the medical world, they call it inspection, palpation, and gathering subjective data. But for our purposes, look, touch, ask is really all you need to remember. So let's break that down a bit. Step 1, look. Are there any weird colors, like is the skin paler than usual, or maybe a bit yellow? Step 2, touch. And here's a pro tip for you. Use the back of your hand. It's way more sensitive to temperature changes. Then you test for turgor and feel the texture to gather even more clues. And this right here is that turgor test. It's a classic, and it's an incredibly effective pinch test. You just gently pinch the skin and see how fast it bounces back. If it snaps back pretty much right away, you're probably well hydrated. But if it stays up in a little tent, well, that can be a super clear sign that you might be dehydrated. Okay, so moving beyond those general checks, our skin can also throw up some very specific warning signs. These are the red flags, the ones that tell us something more serious might be going on, and it's absolutely crucial that we know how to spot them. And maybe the most critical checklist in all of skin assessment is this one: the ABCDEs of skin cancer, especially melanoma. It's a simple little mnemonic, but it's a really powerful tool for early detection. And this lays it out perfectly. A is for asymmetry, B is for an irregular border, C is for having varied colors, D is for a diameter that's larger than a pencil eraser, and E, this one's really important, is for evolving, meaning the mole is changing over time. And listen, here's the key takeaway. Just one of these signs is enough of a reason to go see a doctor. When it comes to melanoma, catching it early is everything. So now we've seen the clues, we've seen the red flags, but a lot of these signs, from your skin's temperature to its hydration level, they're actually messages from a much deeper hidden system inside our bodies. So let's unmask the messenger. And that messenger is the endocrine system. This is basically the body's master control panel. It's a whole network of glands that produce and send out hormones. You can think of hormones like little chemical text messages that tell different parts of your body what to do, controlling pretty much everything from your metabolism to your mood. And I just love this key and lock analogy. It shows so clearly how specific hormones, which are the keys, are designed to fit only into specific receptors on your cells, the locks. So a thyroid hormone won't fit into a receptor that's meant for insulin. It's how the body sends super precise instructions to exactly the right places. Okay, this is the part where it all clicks into place. Now we can start connecting those external clues we see on the skin directly to their internal causes, deep inside the endocrine system. This is kind of like the final verdict. This table, this is the big reveal. Just look at these connections. That cool, pale, rough skin we talked about earlier, that could be a sign of an underactive thyroid. And then on the flip side, if skin is unusually warm and smooth, it might point to an overactive thyroid. Poor skin turgor? Yep.
classic sign of dehydration, which can be tied to things that throw off your fluid balance, like high blood sugar. Even your nails separating from the nail bed can be a clue. And these clues can get incredibly specific and sometimes pretty subtle. Here you see spoon-shaped nails, which can be a sign of iron deficiency anemia. And on the right, those are protruding eyes, which is a classic sign associated with an overactive thyroid or hyperthyroidism. You see, the body is leaving clues absolutely everywhere. And this quote just drives home why all of this is so important. We can't actually see or touch most of our endocrine glands, like the thyroid or adrenal glands. They're buried deep inside for protection. And because of that, a direct physical exam is pretty much impossible. So the skin becomes our window, right? It's our main source of clues into the health of this incredibly vital but totally inaccessible system.
So, what's the big takeaway here? It's this. Your body is constantly communicating, and your skin is one of its favorite languages. Now, learning to notice these signs isn't about diagnosing yourself, not at all. It's about awareness. It's about knowing when your body might be trying to ask for a little extra attention. The only real question left is, are you listening?